Hello, I'm Victor Visor, and today on The Good Economy, I'll be discussing healthcare policy in the presidential election. Healthcare for Americans has proven to be a key voter issue in the 2008 presidential election. In this country, there are nearly 60 million uninsured people. That's 1 in every 5 Americans without health insurance. And in terms of the cost of our health insurance, Americans spend more per capita for it than the citizens of most other developed nations. For example, Americans pay about $6,000 per year for their health insurance, compared to a little over $3,000 per person in Germany and Canada. The Republican Party, in power for the last 8 years, has proven to be largely ineffective when it comes to managing public health care policy in this country. In fact, don't count on Republicans for health insurance for every citizen. There have only been 2 presidents to propose health insurance for all Americans, and they were both Democrats, Harry Truman in 1948 and Bill Clinton in 1993. Republican presidential candidate John McCain wants to do for health care what deregulation has done for the banking industry today. And given the state of the present financial markets, that's a very disconcerting prospect. McCain's health care plan is designed to injure small businesses by eliminating the tax breaks for employer-provided health insurance and to actually take away insurance from those who need it most. In the words of New York Times columnist Paul Krugman, McCain's health care plan is a process that would comfort the comfortable while afflicting the afflicted, and one that would also lead to a huge, expensive increase in the federal bureaucracy. And without the tax breaks for employer-provided health insurance, many employers would be forced to drop their company health plans, meaning that another 20 million Americans would lose their health insurance. To reform health insurance and to make it more widely available, Barack Obama suggests an incremental approach: regulation of insurers to prevent discrimination against the less healthy, subsidies to help lower-income families buy insurance, and public insurance plans that compete with the private sector. It's not a plan for immediate universal health coverage, but it's one that would drastically reduce the number of uninsured Americans right away. And it's one that puts health care insurance in the hands of those who, in fact, need it the most. It's just simple common sense in business that a healthy worker is a productive worker. To this end, health care coverage for all Americans should be the goal of the next president, a goal that puts as its measure a better American economy. Ultimately, when considering the health care proposals of the 2 presidential candidates, it's only the Democrat, Barack Obama, who comes close to that ambition. You've been watching an installment of the Good American Economy series. For more about this episode and to see how your vote in the presidential election is an important one, visit our website at www.goodamericanaconomy.com. There you'll find additional videos and documents that expand upon today's topic and much more. Thanks for joining us, and we'll see you again on The Good American Economy.